Hello, my name is Therese Mendoza. I'll be performing a head-to-toe assessment for Maryville University. My patient today is Sarah. Her general inspection is good hygiene, appropriate interaction. She has steady gait, no acute pain. Her pain level is 0. Prior to the examination, she was asked to empty her bladder, remove her clothing, put on a gown. Distance vision was done via Snellen check. Full vital signs was done, height and weight. I already washed my hands. Okay, hi Sarah. I'll be doing a head-to-toe assessment today, starting with your head and going to your feet. Okay, first thing I'll do is I'm gonna inspect your head and your face. Your skin is normal. I don't see any discoloration. I don't see any lesion, any redness. Okay. Um, your eyes, nose, mouth, ear are symmetrical to your face. Your hair, I can see that you have equal distribution. I don't see any alopecia. Okay. Okay, I'm going to ask you to do some cranial nerve tests. I'm going to ask you to clench your teeth. Put out your thumb. Okay, smile. Puff your cheek. Close your eyes shut. Okay, and then wrinkle your forehead. Okay, so your cranial nerve 5 and 7 are intact. Okay, now I'm gonna palpate your scalp and your hair. The distribution is equal. Your hair follicle is normal. I don't see any flakes. I don't see any lesion. Your hair color is black, thin and shiny. Very good. Okay. Okay, now I'm gonna inspect your eye. All right. Your eye, your eyelid is easily open and closed. Your eyelashes is extended upward and outward. All right, very good. Okay, your eyebrow is evenly distributed on both sides and it's extended to the outer conus of your eye. Very good. Okay, now I'm just gonna palpate any nodules on your eye. I don't see any inflammation, nothing like that. Okay, and then your lacrimal apparatus, I'm gonna palpate it. Okay, is it tender or in pain? No. Okay, now I'm gonna palpate your frontal bones. Do you feel any pain? All right. Now I'm gonna palpate your sinuses, starting with your frontal. Okay. Any tenderness or pain? All right. Very good. Okay. Okay. Very good. Okay. Now I'm gonna ask you to close your eyes and let me use a cotton. Let me know if you feel the cotton on both sides of your do you feel it? So this is a light sensation test on your face. Okay, so it's equal. Okay, very good. Okay, now I'm gonna ask you to so now we're gonna test your eyes, the light response to light. Okay, I'm gonna ask you to look at the wall and then just one point. Let me know if just look at the wall, okay? Not moving your head. Very good. Reactive to light is good. All right. Okay, so now I'm gonna ask you to cover your left eye, looking at me. Very good. And then the other eye. Very good. Okay, good. So I didn't see any extraocular movement or nystagmus. All right. Now I'm going to ask you to follow the light. So this is just to see the 6 cranial six cranial gaze. Okay, very good. Okay, very good. So I didn't see any extraocular movement or nystagmus. So now I'm going to ask you to close your right eye. And then I'm going to close my left. Let me know if you see my two finger coming to you. Very good. Yes, okay, the other eye. You see my two finger? Okay, very good. Okay, so I didn't see any lateral nystagmus or any extraocular movement on your eye. Okay, now we're gonna I'm gonna inspect your ear. So both ear, the colors are good. They're symmetrical to your face and your eyes. I didn't see any redness. All right, now I'm gonna palpate your auricle. All right, I didn't feel any nodules or any swelling, nothing like that. No drainage. Yeah. All right. So with the otoscope, I'm gonna check the canal membrane and the tympanic membrane. All right. Pulling up and back. All right, good. So I didn't see, and your tympanic membrane is pearly gray. The ear canal is free of obstruction. Pull up and back. Okay, good. And no surrender. Okay. So now I'm gonna inspect your mouth, starting off with your lip. It's pink and moist. There's no crack or anything. Now I'm going to ask you to open your mouth, show your teeth. Okay, so you're wearing dentures on both up and lower. Okay, now show me your gums. Okay, all right. And buccal membrane is not bleeding. Very good. So I'm going to ask you to open your, put up your tongue. Okay, your tongue is pink. I didn't see any arrhythmia or edema. Now side to side. Okay, the lateral floor, I didn't see any on your tongue, any arrhythmia or edema. Now the floor, the lower, up your tongue. Okay, so it's red. I didn't see any arrhythmia or any discoloration. Now I'm going to ask you to reflex. Okay. Okay, good. Say ah. Okay, good. So I can see your tonsil, your pillar, and your alveolar, and the softened hard palate. 2+. No inflammation or redness. Out of the normal. Alright, and then your gag reflex. Alright, good. Okay, now I'm going to go back to your nose. So your nose is in the midline, symmetrical to your eyes and your ears, so your face. Your septum is in midline. Now I'm going to just ask you to raise your head. Okay, good. So no obstruction, redness, or swelling. All right. Okay. Now I'm gonna inspect your neck. Okay, so it's smooth. All right. Clear. Your skin color, no discoloration. I didn't see any jugular vein distension. I didn't see any goiter. All right. So now I'm just gonna palpate your carotid. 2+, 2+. Now to the midline of your trachea and your thyroid. Any tenderness here? Okay, I'm gonna ask you to swallow. Okay, very good. Okay. Okay, so now I'm just gonna feel on your lymph nodes, starting off with the post-auricular, pre-auricular, post-auricular, mandibular, mental, tonsillar. Alright, submandibular. Alright, super deep cervicular. Alright, supraclavicular, and your axillary. Can you feel any tenderness? Okay. Okay. Now I'm gonna osculate your carotid pulse with the bell. Okay, it's pretty strong. Very good. I didn't hear any bruit. And then your thyroid. Alright. Okay, now we go to your upper extremity. Alright, so just looking at your arm, your muscle tone is good. I didn't see any discoloration here. Your distribution is good. Fingers, less than 2 seconds. Capillary refill, I didn't see any clubbing. Now I'm gonna just feel on your radial pulse. 2 plus, 2 plus, 2 plus, 2 plus. Okay, now I'm just gonna get your reflex. Alright. Alright. Okay, very good. Now I'm gonna check your posterior chest, okay? So I'm gonna ask you to turn. I'm just gonna raise your shirt up, okay? So just breathe in and out. Okay, breathing is on labor. Alright, equal to both sides. Now I'm just gonna palpate and percuss on your costovertebral angle. Costovertebral angle. Okay. Now we're gonna just do the tactile firmness on your back. So just say 99, okay?
99.
Okay, so it's equal. Alright. Okay, now I'm just gonna percuss, okay? So I'm just looking for resonance. Okay. Any tenderness at the back? No? Okay. I'm just gonna listen to your lung sounds. Systematically. Okay, just breathe in and breathe out. Okay, very good. Okay, now I'm just gonna measure the your lung. Okay, just look straight. I ask you to breathe in, and then I'm just gonna percuss. Okay. Okay, breathe out. Okay. Just gonna mark this one. And the other one, breathe in. Okay. Okay. Now I'm gonna ask you to breathe in again. Just hold it. All right, good. Now breathe in. All right. So marking about 3 centimeters on both sides, so it's equal. All right. Okay, now we're gonna, let me do the lateral side by asking you to, just sit down. Okay, just gonna break up. Now I ask you to raise your hand. All right, good. Okay, so now we're gonna do the posterior. Okay, so I'm just gonna have you breathe in and out regularly. Alright, so it's on labor. Alright. So I'm just gonna locate your carotid, your apical pulse. Pulse is right here. Okay, just breathe in. Alright, good. Now, so it's located on your left chest. Okay. Now, I'm gonna do the tactile firmness on your front. So just say 99 again. Okay. Now I'm just gonna percuss. Okay. All right. Okay. Now I'm just gonna listen. Starting with the aortic. Pulmonic. Nerve spine. Or you hear the S1 and S2. Mitral, tricuspid, and mitral. Alright. Okay. Alright, now I'm gonna have you sit on the lay down. Alright, so I'm gonna thank you. Okay, so we're just gonna expose your abdominal. We're just gonna listen to your bowel sound. So this is for 2 minutes. All quadrants have hyperactive. Okay, so now I'm gonna listen to the aortic on both sides. Iliac. Femoral. Okay. Alright. So now I'm just gonna do a light palpation. Any pain? No. Okay. Now I'm just gonna do a deep palpation. Just wanna see your liver, if I can palpate. Alright. Now this the spleen. Coastal spleen. Alright. Okay. Aortic pulsation, midline. Okay, just don't move. Right kidney. Left kidney. Okay. Okay, so now I'm just gonna test your sensation on your extremities. Let me know if it's a hard. So this is hard. This is soft. Okay. Close your eyes. Okay. So, okay. Good. Okay. So I'm just gonna inspect your lower extremities, warm and dry. Hair distribution equal. Capillary refills less than 2 seconds. Okay, I'm just gonna listen to your um, poplite pulse, 2 plus, 2 plus, tibial, dorsarocipedis. Okay, now the strength on your lower extremity, I want you to push your feet against me. Alright, very good. Alright. Okay, so now I'm going to ask you to sit on the edge of the bed. I'm just going to do some reflex. Okay, on your Achilles tendon, and then your knee. Alright, very good. So I'm going to ask you to sit up. I'm just going to check your back. Okay. So I want you to touch your, try to touch your line, okay? So the cervical and lumbar spines are midline and it's even. Alright. I'm going to ask you to sit down. And that concludes our head to toe assessment. Thank you again, Sarah. Thank you.